Good morning everyone. Today I am going to present a paper on pars plana vitrectomy in chisel hammer injury associated with an intraocular foreign body. So chisel hammer injury associated with intraocular foreign bodies is a major occupational health hazard. It can cause wide range of complications including cataract, retinal detachment, metallosis and ophthalmitis. So surgical intervention often via pars plana vitrectomy is commonly required as early as possible to restore vision and to prevent complication. So the objective of our study is to evaluate anatomical and visual outcome of pars plana vitrectomy in chisel hammer injury associated intraocular foreign body and to evaluate the various predictive factors associated with the outcome. So the population we chose were patients who presented at ophthalmology OPD or trauma emergency of AIIMS Rishikesh and underwent PPV for retained posterior segment intraocular foreign body following chisel hammer injury. The study design is a retrospective case series. It includes 5 years of time period starting from 2019 April to 2024 March. So patients of any age and gender having metallic intraocular foreign body due to chisel hammer injury and having post-operative follow-up of at least 3 months were included in the study. So as it is a retrospective study, so medical records of all patients who underwent PPV for retained posterior segment intraocular foreign body between April 2019 and March 2024 were retrieved. All clinico-demographic parameters including preoperative, intraoperative details were retrieved and assessed. Then we compare the anatomical and functional outcome at 3 months post-operatively. So these are the following parameters which were assessed to search for any correlation with post-operative visual and anatomical outcome. The preoperative factors that we assessed were duration of ocular symptom, interval between OGI repair and PPV, best-corrected visual acuity at presentation, zone of injury, extent of injury, and other associated complications. The intraoperative factors that we assessed were the impact site of foreign body, lodgement site of foreign body, whether lensectomy was done or not, or were we able to retrieve foreign body or not. The post-operative factors that were assessed were BCV at 3 months, anatomical outcome at 3 months, and was there associated macular scars at 3 months. So there are 3 pictures. The first picture is showing a relatively small intraocular foreign body which we were able to retrieve successfully by transscleral route. The second is relatively large intraocular foreign body from macula which we removed by lensectomy, like following lensectomy by transcorneal route. The third image is showing a perforating intraocular foreign body beyond optic nerve head which couldn't be retrieved by pars plana vitrectomy due to its deep location and close proximity to neurovascular structures. So when we analyzed results, we found that the total number of patients that we assessed were 29. The mean age group of patients were 29 years. The mean interval between the OGI repair and PPV was 7 days. The maximum patient presented with zone 1 injury. 20% of the patients had end off at presentation and majority of patients had vitreous hemorrhage at presentation. So we, in the intraoperative findings, we did lensectomy in 82% of the individuals. We were able to remove intraocular foreign body successfully in 86.2% of the individual, and we did it by transcorneal route in 88% of the individuals. The impact site and lodgement site was different in 55.2% of individuals. So we had favorable anatomical outcome, that is retina attached at 3 months post-operatively in 86.2% of individuals, and patients with visual acuity better than 3/60 in 55.2% of the individuals. So we found out that the increased interval between OGI repair and PPV, the large extent of entry wound, vitreous hemorrhage at presentation, and post-operative macular scar was associated with worse visual outcome. We also found out that the patient who had pre-operative better visual acuity also had post-operatively better visual acuity. And the only significant factor associated with better anatomical outcome was the absence of retinal detachment at presentation. So we conclude that pars plana vitrectomy with appropriate adjunct measures significantly improve anatomical and visual outcome in most of the chisel hammer intraocular foreign body cases. Iris injury, traumatic cataract, VH and RD end off were major complications associated with such injuries. The deep-seated intraocular foreign bodies beyond optic nerve head or scleral course may be difficult to retrieve, and we found out that better best-corrected visual acuity and absence of retinal detachment at presentation were the only factors associated with significant better post-operative visual and anatomical outcome respectively. As we noted, the increased interval between OGI repair and PPV for intraocular foreign body removal was associated with significantly worse visual outcome, and it is the only modifier factor that we as a doctor's hands have in our hands to intervene. So we should perform PPV as early as possible for successful visual outcomes. Thank you. Yes, ma'am. Post-operatively, we assess after removal. Yes, intraocular. Yeah, after removal, ma'am. After removal, we assess the size of intraocular body. Majority of the intraocular bodies that we found were between 4 to 5 mm. 4 to 5 mm.